Today, I have the pleasure to introduce and talk with Dr. Paul Clark, CMIO of Concord Hospital in New Hampshire. Dr. Clark will tell us about the steps they took to plan for the increase in COVID-19 patients, as well as how they will deal with a new normal after the initial peak. He'll also tell us why they chose WellSheet and how WellSheet fits into these scenarios at Concord Hospital.
Concord Hospital is a community hospital based in Concord, New Hampshire, which is in the central part of the state. We're a single facility system with a licensed bed of about 295, second busiest emergency room in the state, and we have 26 different clinics. We are currently in a crisis in the pandemic and have leveraged this technology. We implemented a new EHR with Cerner back in December 2017. And like a lot of transitions to a new EHR, there's been challenges. And one of them was just being able to visualize data and information. And we decided to look for a company that could help us do data visualization and help people find information more efficiently in the chart to improve their workflow. And we started with WellSheet really for that purpose. We also, with WellSheet, we're working on a COPD initiative where we're trying to improve care of our COPD patients. It turns out it was a very fortunate situation for us that we were able to do this because WellSheet ended up offering us an opportunity to deal with the crisis that came upon us pretty rapidly. One of the first challenges we had was just how to identify and manage patients that were COVID-19 patients. When we first started, we really weren't certain what that would look like or how we'd manage it. And after talking to WellSheet, we're able to create a visual display that really allowed our infectious disease director as well as our emergency room director manage these patients as they came in. But trying to manage that and understand where people were and their status on COVID would have been challenging, and I think would have probably involved a lot of paper processes. With WellSheet, we really have the opportunity to log in, and we've created a view of the COVID patients, and we can immediately identify how many COVID patients are currently in the hospital, which units they're on, and we also have been able to show their COVID status, whether their tests are pending or return positive, negative, or a second test pending. We can also show level of ventilatory support, including whether they're on a vent. This type of instantaneous information that's updated in real time is revolutionary, and particularly Dr. La Rochelle in the emergency room department felt that he has had pretty good control of the situation from day one. I would say overall, the experience just managing our current hospital was really, this was game-changing in terms of our ability to see where we were at any given moment and what our capacity was and how many beds, particularly for vented patients, were being utilized. Yeah, and I think being able to leverage what we have in WellSheet to manage the current COVID population in the hospital is really key, because I can log in this one and see how many COVID patients we have in, see how many on vents, and we could quickly pick up a trend looking at that data and know what our capacity is in terms of ventilators. That's huge. That's been a really powerful tool for us. We're really excited about ongoing relationship with WellSheet and their ability to deliver what we need. And again, some of this is to provide reduced physician burnout, but a lot of it is also just to enhance patient safety and getting information in front of the clinician in a way they can make the appropriate decisions more accurately and more quickly.